Hello, and welcome to Massage Therapy. Today we're diving into the brachioradialis muscle, a key player in your forearm. This muscle originates from the lateral supracondylar ridge of the humerus and inserts into the styloid process of the radius. It's primarily responsible for flexing the forearm at the elbow, especially when your arm is in a mid-pronated position, like when you're holding a hammer. In this video, we'll start with a simple yet effective technique to release tension in the brachioradialis, so let's get started. Let's start with a pin and stretch technique. This one often gets my patients to go, wow, wow, wee, wow, because it can be quite sensitive. First, be sure to identify the origin of the brachioradialis muscle. Grab your patient's hand as if you were going to arm wrestle. This gives you maximum control of the arm. Start by gently lifting the arm so you can place your left hand just above the elbow, ensuring a good grip and good contact. Supinate your patient's arm with elbow flexion. Then pin the muscle at the origin. Extend the elbow and pronate the arm simultaneously until you reach to full extension. Release the pressure on the return stroke. You can stand or kneel for this technique. Find the one that best works for you. Take your time and move rhythmically, avoiding a clunky or uncertain feel. You can gradually work your way down the brachialis muscle, half inch at a time. But wait, there's more. For patients who have a hard time relaxing, there's an active variation of this technique. Stand over the arm and instruct your patient to flex their arm while you apply pressure with both thumbs at the origin, same as before. Ask them to extend their arm slowly until they've reached full extension. Seem familiar? Using the pads of your thumbs provides a broader, less intense contact, while switching to the tips of your thumbs can make it more intense due to the smaller contact point, like I am. Now, let's talk about the handshake grip. It's not just for greetings. It offers a precise control over the arm, wrist, and elbow. This control opens a door for a more dynamic massage experience, incorporating movement seamlessly. Remember, while Swedish strokes are foundational, it's the little details and innovative techniques like this that elevate the massage experience. Let's strive to make every session unique and memorable. Let's get into deep stripping. Think of the brachioradialis as having three sides: the medial, superior, and lateral. Using this as your guide to ensure maximum coverage during the massage. Now, regarding the direction of the strokes, I prefer working from insertion to origin, but remember, this is just a preference. Later on, I'll demonstrate a few examples to give you a better idea. When it comes to stripping, the key is to stack the joints of your thumb so they're completely straight, no weird angles. Here's the trick. Focus on loading the muscles of the thumb, not the structures, by flexing the IP joint slightly to add depth. It might feel a little awkward at first if you're not used to it, but trust me, it requires less pressure to be effective. And remember, when you encounter trigger points or adhesions, include slight wrist movement to progress the movement further. Now, let's explore a slight variation. Instead of solely focusing on one side, strip the muscle from both the medial and lateral sides simultaneously. To do this, create a C shape with your hand, driving pressure into the medial portion with your thumb, while the index and middle fingers take charge of the lateral portion. If you're looking to spice things up even more, give it a nice shake. This added movement can intensify the release and provide a refreshing sensation for your patient. I think this might be a reasonable time to ask, would you consider subscribing? But only do so if you feel like I've earned your subscription. If not, not a big deal. I'll catch you in the next video. But do me a favor, give that like button a little tapotment for me. Moving on to some cross fiber stripping. Use the same handshake grip as before. Start by placing your patient's arm in a fully pronated position. Anchor your thumb at the most lateral, distal part of the brachioradialis muscle, right above where it meets the tendinous area. Then, supinate the arm slowly until your thumb has completely traversed the muscle belly. Move deliberately and steady. Sometimes it might feel like your thumb won't budge, but trust me, keep turning. When the brachioradialis muscle gets too tight, it can squeeze on the nerves around it, causing symptoms like pain, numbness, tingling, or weakness in the forearm and hand. The radial nerve especially can be affected because it's right next to the brachioradialis muscle. If it gets compressed or irritated, it can lead to radial tunnel syndrome. But don't worry, I got a technique that is really effective for tackling this problem. I call this one the pinch and lift. Since the radial nerve runs below the brachioradialis muscle, this technique can alleviate some of the pressure by lifting the muscle up and away from the nerve. Get as close as you can to the origin and form a C shape with both hands. Pull the muscle away from the nerve to allow it to flow. Hold the grip for a minimum of 10 seconds. Then work your way down half an inch at a time until you can no longer get a grip on the muscle. This technique works best with a small amount of lubricant or even dry for best grip. From this position, you can sneak in some stripping from proximal to distal using a single or double thumb stripping. Experiment with these techniques and remember, there is no one size fits all approach to massage. Moving on to deep ironing. Everyone knows about ironing, but the true key to this technique is stacking your joints. Position the table at a height where your arm is completely straight. A few common mistakes I often see include massage therapists squeezing the hand way too hard. You want your fist to have a small give to it, like holding an egg, squeezing just enough to keep it safe but not smash it. Another mistake is bending the elbow. If the elbow is bent, the table's too high. This can make your pressure inconsistent and unsteady, leading to quick fatigue. Make sure your shoulders stay square and don't shrug them. I always ensure I can feel my lat engage to keep my scapula anchored to my ribcage. Most of the pressure, if not all, should be primarily on the index and middle finger knuckles. The others are just along for the ride. Experiment with both arms, and be sure to try both sides to see what best works for you. Be mindful of all the bony landmarks in the area, like the radius and ulna bones. Soften the pressure as you reach these tendinous, sensitive areas. Moving on to our last technique. Don't hesitate to utilize your elbow on the forearms, especially if they look like this. More on that later. Start by clearly identifying where the muscle belly starts. Use your ulna like a handsaw, envisioning cutting down a tree. Glide your ulna across the muscle belly in a sawing motion. Once you reach the olecranon, reset the stroke. There's no pressure on the return stroke. Work your way slightly past the elbow, addressing the origin and other muscles nearby, like the brachialis and the biceps. Did you know they sell muscular plastic arms for chickens? I was scouring the internet for a muscular image to use for the videos, and I stumbled upon this. Oh my god, this is freaking cracking me up. Did you guys know this existed? I was just about to wrap up the video, and I had to share this amusing find with everyone watching. Now I kind of wish I had some chickens. Anyways, I hope you guys enjoyed the video. Thank you so much for watching. Consider subscribing, hitting that like button for me, and I'll catch you guys on the next one. Peace.